How to protect children under 12 from COVID-19. According to FauciMore, children have needed emergency room visits and hospitalizations in states with lower vaccination rates, according to a recent study from the Centers for Disease Control and Prevention. In the 2-week period in mid to late August, ER visits for kids up to age 17 were 3.4 times higher in the states with the lowest vaccination rates, and hospitalizations were 3.7 times higher than in states with the highest vaccination rates. Some states are working to get ahead of the latest surge by getting as many eligible people vaccinated as possible. The state of Washington, which has an October vaccine mandate for teachers and staff going into effect, is seeing great news regarding youth vaccination efforts, according to State Health Secretary Umer Shah on Thursday. At least 41% of children between 12 and 15 years old are vaccinated, and just under half of the state's 16 to 17-year-olds are fully vaccinated as well. Washington schools have the structure, protocol and people to have successful in-person education, Shah said. If the US wants to keep children in the classroom this school year, people have to wear masks, Fauci said. But while some areas have adopted mask and vaccine mandates, others have curbed such measures. In Kentucky, Governor Andy Beshear said he's limited on what he can do because state officials opposed his attempt at a school mask mandate. "If I had the ability to do it right now, we would have a masking order when you are in public and indoors. We know that's a proven way to slow the spread of the virus and ultimately help our healthcare capacity," Beshear told NBC on Sunday. Tough choices loom about who gets an ICU bed. Fauci warns some hospitals in the United States are close to full capacity as COVID-19 continues to spread, and soon officials could be making choices about who gets an intensive care unit bed, Fauci said. "We are perilously close," he said. "You're going to be in a situation where you're going to have to make some very tough choices. Masking is important," Fauci noted, "but vaccination is the #1 method of lowering hospitalizations." A federal medical team arrived in Kentucky this weekend to help increase medical assistance and the ability to open more hospital beds in light of record-breaking coronavirus cases and hospitalizations, according to a statement from Governor Beshear's office. "Our situation is dire," Beshear told NBC's Meet the Press on Sunday. "We are hit very, very hard, but we are going to continue to fight. When you're at war, you don't get to cry about what you can or can't do. You've got to do your very best every day because this is a battle of life versus death." Beshear said he sent the National Guard to the hardest-hit hospitals to work on logistics and free up clinicians to attend to patients. "The emergency department is full and the hospital is full," Black said. "Anytime a patient is discharged, we have patients waiting on those beds." Moderna may lag behind Pfizer in booster rollout with the spread of the highly transmissible Delta variant disrupting life across the US. Officials and health experts are working toward administering a booster dose of vaccine to Americans. Fauci said vaccine maker Pfizer has gotten its information to the US Food and Drug Administration. "The information has been examined and things look like they're ready to go. But," he said, "Moderna might be a little bit behind Pfizer, and if it is, rather than seeing a simultaneous rollout of both products, it would be a sequential rollout by about a week or two. I don't think that is a major issue there, but we would have liked to have seen it happen all together, simultaneously. But ultimately the plan will be implemented, as was put forth," Fauci said. "The plan is contingent, first, on the companies submitting the appropriate data to the FDA, and second, getting an approval from the FDA and then a recommendation from the CDC's vaccine advisors," he said. With the potential timing discrepancy, researchers are looking into whether different types of COVID-19 vaccines can be mixed and matched. "We're lining up Pfizer against Pfizer, Pfizer for Moderna, and vice versa," Fauci told Weijia Jiang on CBS Face the Nation on Sunday. "Hopefully, within a reasonable period of time, measured in a couple weeks, we will have that data." Fauci said hopefully it will work out that people who got Pfizer will boost with Pfizer, and people who got Moderna will boost with Moderna. "But we are doing the studies to determine if you can, switch one with the other, he said. Number of COVID-19 cases 4 times higher than Labor Day 2020. This Labor Day weekend, the 7-day average of new coronavirus cases was more than 4 times higher than it was on Labor Day 2020, according to data from Johns Hopkins University. COVID-related deaths have also increased, according to JHU, and the U.S. Department of Health and Human Services reports that COVID-related hospitalizations have gone up. 2. Here's how the COVID statistics have changed from Labor Day 2020 to Labor Day 2021, according to data from JHU and the DHHS. Daily cases Labor Day 2020, 39355. Labor Day 2021, 163728. Daily deaths Labor Day 2020, 804. Labor Day 2021, 1561. Hospitalizations Labor Day 2020, 40600. Labor Day 2021, 99270.
Thank you for watching. Please subscribe.